So why we're demonstrating the stretch marks is because I often get people ask me how far should I push it. So we'll just demonstrate that. Obviously you don't go too far on their first treatment, always do it more conservatively, and you need to think about their predisposition to hyperpigmenting. So if they're a darker skin tone that is prone to hyperpigmenting, you can't push it too far, you just have to do more treatments. Jackie's had how many treatments? Not very many, but she has had a few, so they have reduced quite a lot. So there's just those last little ones, so you can see those there. So stretch marks you treat monthly, and they must be on beta gel and vitamin C, Contraderm of a day, and Redoxin of a night time. So they were worse, but she has had a couple of revisions already. Just cleanse with your hydrolutha. Mix your alkaline with distilled water. Not tap water, distilled water. You don't want to have your towel too hot for alkaline. Okay, then you just put your alkaline over the area, so you can see there and just through here. So as they reduce, you can start to get quite specific. What are these little red rashy things? Oh, her jeans are too tight. She ate too many of the banoffees. Did everyone have one of those little banoffees? Those little cream-filled banana things. Big one. I did. So you just leave that sit for 3 minutes, and then we're just going to work it in a little bit. But you need to leave it sit for 3 minutes to let it swell. If you just started rubbing, you'll just irritate, where you'll actually dissolve better once it's all swollen. So that's still quite moist. I don't need to spray that yet, but you do spray it to keep it moist. You don't want it to dry. I find with alkaline, don't work with it too thin because it's just too hard. It just dries too quickly. So having it a little bit thicker makes it easier to work with. Okay, so then you start to work it in a little bit. So what I suggest is move it to the side so you can actually see underneath it and stretch the skin. Jackie's aren't that deep, but sometimes they feel hollow, so it's really easy to feel where they are. So you push in a little bit firmer than you normally would. And I do up and down and across. So you can see I'm being quite specific, and I can feel the stretch marks under there. So keep moving the alkaline so you can actually see underneath it. So with this, you're just looking for it to be a little bit pink. So it can be quite detailed. You've got to really watch every area. Okay. See how I'm being quite specific on the, I'll go the other side. So they're looking a little bit pink now. Remember, it doubles. So I'll just show you that amount of pink. Marshall can get in there. So you can see how they're just a little bit pink. That's all you need to do. So then you neutralise with your ectoderma. Then I'll just work a little bit more on this other area. Just spray it. Stretch it. Also get them to tell you if they start to feel any change in sensation. So it's a little bit pink there, but I could do a little bit more there. So once you've had a look, you can go in. Okay, so she's feeling it, so I'm going to trust her judgment. You want to get more blood vessels to grow into that area. You don't want to constrict. So you can see from when we removed to now, see how that's gone a little bit more pink there? Just leave that neutralizer on for about 5 minutes. And remove your neutralizer with a clean towel, not the one that you took your alkaline off with, because you don't want to wipe alkaline back into the area. That's a good amount, conservative. You could go a little bit more if you wanted, but it just depends on the person. Use a warm to cool towel, not hot. Then remove your neutralizer gently. Don't wipe too much after alkaline. Then do your both drops, your Melanotech drops, and luckily they don't sting anymore, which is quite pleasant. Pore reduction. You can do some low-level laser. So with your low-level laser, always have it on high. So you turn it on, turn it to high, and then you just hold here, just go along the stretch marks. So you just hold it about 15-20 seconds and then move it about 1 or 2 centimetres. It's not a big area, so. If you do have a low-level laser, for those really high cortisol, really stressed clients, you actually have a point up under here, an acupuncture point. You do low-level there and there on each side, and it will bring the cortisol down, relax them before their treatment. So you could just do, with your low-level, just do about 20 seconds in each side before they lay down to put their enzyme on. If you have a derma field, if you're lucky enough to have the derma field, on those people, put your transducers up here. Usually we put them behind the shoulder, put one up under here. Then I'll just dust over with Actrol powder. So just use one of the dry DMK fan brushes and just seal that over. And then put your body enzyme on. When I do stomach, just hold that there. I do a line through the middle, like so. You can use this or just a normal body brush. And then I fan out. In line with those lymph nodes and going down into those lymph nodes. And not fanning it to dry it, just to set it. So body enzyme just stays on for 30 minutes. You can leave it for 40 if you want, but 30 is minimum. Okay, again, just break it down gently with stretch marks with your hydrolufa. With stretch marks, the home care is the biggest part of them getting the result. So if they don't want to commit to taking full home care, don't even do the treatment, which is your beta gel, vitamin C, Contraderm of a day, and your Redoxin of a night, and taking 2 EFAs morning and night. So see how it's quite pink, a little bit rashy looking? So that's actually the perfect amount of inflammation. Melanotech drops, pore reduction drops, beta gel, vitamin C, herbal pigment oil. So Melanotech drops, pore reduction, vitamin C. Fibramax might, when it's this, it might be a little bit too strong, so I wouldn't do that on this day. Beta gel. And I'll get Jackie to take a photo and put it up on the network so everyone can see tomorrow, and then spray it with your mist. Contraderm.
Jackie, just so I can write it, how many treatments have you had? This being the 4th or 5th treatment?
And if we could have your befores, Marsh could put them in.
Yeah, I'll just whack them up.
And after that, you just dust over and seal it over with your Actrol powder. There we are. Thank you, Jack.